a lot of people feel like adding anything else on their plate is impossible. And I understand that reaction. And I think that it's true. I think that people are maxed out. There's not a lot of time. And so how do you, get them to understand that this is something worth their while? I think showing them that the preparation is worth it, because then it makes that time, especially with the physician that is so tight and so precious, more efficient. So I think really emphasizing that this could make your day-to-day workflow and work life better, but there's going to be a certain amount of investment in it.
It's always easier to give one more treatment and not have a serious discussion. It's always easier to do that. You can go in the room and say, well, your blood counts are good. We'll give you one more treatment and then we'll see where you are next week. So it's always easier to kick the can down the road than it is to have a serious discussion. Now, if the person needs to kick the can down the road, that's okay. But if you're kicking the can down the road because you haven't got the system set up and you're not prepared to talk to the person about a serious issue, then that's not the right thing.
When you introduced the SpeakSooner program to me, I felt immediately it seemed like a missing piece that we had in oncology. We lacked the ability to have these conversations with patients up front and early in their care, to get them thinking about where they wanted to go in their life, what their end-of-life decisions looked like to them. And it sounded like a great opportunity to introduce folks and how to have those conversations so that as things developed in their care, one way or another, they were prepared and their clinicians were prepared.
It's great if you have a physician who's communicating very well with the patient and family, but you also need everyone else on that healthcare team to be understanding and speaking that same language. And that's where I think the SpeakSooner can help get everyone else up to speed on what the provider and the patient are talking about.
And this is a value that we all share, is that good communication is key amongst ourselves and with the patients. And we're always talking about our conversations with the patients. I think it is our culture that we all have to be honest, empathetic, and we need to share among ourselves in a way so that everybody that's coming in and out in terms of staff understand where we're at.
And I can pretty much rest assured that I'm going to go in there and talk in the right way, or head the discussion in the right way, because the staff's already told me what to do. They haven't told me what to say, but they've told me which direction the patient is ready to go in, and that's what it saves. And I think that's a tremendous benefit.